Stephanie Bell Flint joins us now to talk about mammograms, and if you have questions, you can send them to the doctors at WLBT.com.
Thank you, Maggie. Joining us is Dr. Larkin Carter, who is with Baptist Health Systems. Thank you so much. Also, he's with the RAD group, known as the Radiological Group.
That's right.
Tell us, you know, mammograms have become just a really big issue in the medical community. I mean, people are fighting over whether you should have them, when you should have them. I mean, every little issue is being debated.
Right. Well, you know, the recommendations really haven't changed. We recommend women start annual screenings at age 40 and every year thereafter. And some women will need to start earlier at an earlier age if they have a real high risk, very strong family history. But that's still the best recommendations that are out there, is to start annual screening at age 40.
I'm also amazed at how many women are still afraid of mammograms. As a matter of fact, I had one this morning, but I have a strong family history, so I started getting mammograms in my 20s, and it's amazing. It's not a party, but it's not that bad.
Right.
And there's still the stigmas out there.
It's a little uncomfortable, you know. You see a lot of stuff on the internet, you know, jokes and things that I think scare people more than they should. But and really the main reason people don't get mammograms is just because nobody tells them to do it.
Right.
And so we try to teach women to be their own advocates, and then to try to make sure they get it every year and try to schedule it around a certain date, their anniversary or something like that, so that they can remember every year to get that done. And many physicians' offices will, you know, send reminder letters and go ahead and schedule you from one year to the next, but not all are in that type of situation. So that's what we try to get women to do.
Well, what about those women who say, okay, I'm not blessed. After I had my children,
yeah,
my breast disappeared,
right,
or went south, and they don't feel like they have enough tissue to
yeah,
maybe have or be stretched, you know,
right,
like you are during a mammogram.
Yes.
What do you say to those?
Well, men get mammograms. That's really the main thing I would say to that is, you know, men can get breast cancer, and we do mammograms on men. Everybody has enough tissue for a mammogram. So that's really not an issue at all.
Or an excuse. Well, you know, I'm wondering, there are actually several men that I'm aware of that have breast cancer or had breast cancer. It's a little bit more common than people think. It's
Right.
just men don't tell it.
Yep. Women have it 200 times more frequently than men. So it's very uncommon in men, but you know, it can occur.
So it's not that uncommon.
That's right.
Now, October is Breast Cancer Awareness Month, so this is a good time for women to have the mammograms, to go in, get their checkup, and like I said, I've been doing it since my 20s, and so it's like old hat for me, and it's not a party. But what about sometimes when women also have to get an ultrasound along with their mammogram? And I know for a lot of them that's frightening to say, okay, is there something wrong? It doesn't necessarily mean something's wrong.
Whenever we read screening mammograms or mammograms in patients who don't have any symptoms, the statistics will tell us that about 1 in 10 times we'll see a finding on those mammograms that have us call a patient back. And we might do some additional mammogram views, or we might do an ultrasound to see if there's anything there that requires biopsy. And so it's certainly natural for a woman to be scared if they get called back, but knowing that 90% of the time they have benign findings or nothing of significance and don't need any further biopsy, and then only 10% of the times will a biopsy be needed, and then a vast majority of those will be benign as well.
How do you handle women who have breast implants?
Well, we do special views for breast implants, and most breast implants now are placed behind the muscle, and we do good mammograms on patients with breast implants. Before they put them behind the muscle, it made things a little bit tougher to see, but that's not an issue. That shouldn't dissuade somebody from getting implants or from getting mammograms after they get implants.
Okay, so that's the best place to have them then, implants under the muscle.
That's right.
That's right,
and that's generally what they do now.
What are the calcium deposits? I've heard of women getting calcium deposits in their breasts. What's that?
Well, calcium deposits can occur just from fibrocystic type changes in the breast and normal changes in the breast. They are one of the signs we look for breast cancer, so that's something that women may get a biopsy for calcifications. And generally those are most frequently going to be benign. Some of the times we can tell that they're certainly benign just by the way they look on the mammogram. Sometimes we really can't tell whether they're malignant type calcifications or benign, so we'll recommend a biopsy. But calcifications are very frequent. Most women will have at least one calcification in one breast from the time they get mammograms.
Bottom line is the earlier the detection, the better the cure rate, right?
That's correct.
All right. Thank you, Dr. Larkin Carter.
welcome.
Thank you so much. And for more health news, you can log on to our website and click on Medical Matters.